Millions of people around the world suffer from lung infections, often without even realizing it. These infections can range from mild to severe, and the symptoms may not always be apparent. In this video, we will delve into 7 signs that could indicate you've had a lung infection without your knowledge. Stick around until the end for a surprising symptom that might change how you think about your health. Let's dive in. Persistent cough. One of the most significant signs of a lung infection is a cough that lingers far longer than expected. Coughing is your body's natural defense mechanism, aimed at clearing irritants and pathogens from the respiratory tract. When an infection occurs, inflammation and mucus can build up in the airways, prompting your body to react with a persistent cough. This cough can manifest in various forms. For instance, serious infections like pneumonia often result in a productive cough, where thick, discolored mucus is expelled. However, not all lung infections present with noticeable mucus. In some cases, you might have a dry cough that doesn't produce any phlegm but still persists for weeks or even months after the infection has cleared. Chronic coughing can sometimes be mistaken for allergies or other respiratory conditions, making it easy to overlook. If you notice a stubborn cough that won't go away, it's worth consulting a healthcare professional to explore its origins. A thorough examination can help determine whether an underlying lung infection is at play. Fever. Another key sign of a possible lung infection is the presence of a fever. While a fever can result from many conditions, it is most commonly associated with the body's immune response to infections. Your normal body temperature averages around 98.6 degrees Fahrenheit, but during a lung infection, this can rise significantly. Infections may cause fever spikes as high as 105 degrees Fahrenheit, leading to symptoms like chills, fatigue, and even headaches. Interestingly, some individuals might experience only a mild fever and continue their daily routines without realizing their body is fighting off an infection. This can be especially concerning, as the absence of obvious symptoms can lead to a false sense of security. Fever isn't the only indicator of infection. Subtle signs like increased sweating, changes in appetite, or even a general sense of unease can accompany fever. If you feel unusually warm or have chills, it's essential to pay attention to your body's signals and consider seeking medical advice. Weakness and fatigue. Weakness and fatigue are common symptoms that often accompany lung infections. When your body is battling an infection, it requires energy that may be in short supply due to illness. The process of fighting off an infection can drain your resources, leaving you feeling exhausted and weak. Additionally, if your oxygen levels drop because of lung inflammation or infection, your body has to work harder to function, exacerbating feelings of fatigue. You might find that even simple activities become daunting tasks, leading to a cycle of decreased physical activity and further weakness. It's crucial to recognize that prolonged fatigue can significantly impact your quality of life. If you've noticed persistent fatigue that doesn't improve with rest, this could be a crucial sign that warrants medical attention. A healthcare provider can assess your condition and help develop a plan to restore your energy levels. Shortness of breath. Shortness of breath is another telling symptom that may suggest you've had a lung infection. This difficulty in breathing can linger even after other symptoms have resolved, often due to residual inflammation in the airways. You might find yourself becoming easily winded during activities you used to manage effortlessly, such as climbing stairs or taking a brisk walk. Experiencing shortness of breath can be alarming, especially if it interferes with daily activities. If you find yourself struggling for air during routine activities, it's advisable to seek a medical evaluation. Healthcare professionals can conduct tests to assess your lung function and determine if treatment is necessary. In some cases, they may recommend specific breathing exercises or pulmonary rehabilitation programs to help improve your lung capacity over time. These interventions can be incredibly beneficial, aiding in recovery and enhancing your overall lung health. Recent bad cold. If you've recently had a bad cold, consider whether it might have developed into a lung infection. The symptoms of a cold can overlap significantly with those of more serious respiratory infections, making it challenging to differentiate between them. For instance, viral infections like the flu can set the stage for bacterial lung infections due to the disruption of normal bacteria in the lungs. Even mild symptoms might indicate a lingering infection. If you've been feeling unwell after what seemed like a typical cold, it's worth consulting a doctor. Some lung infections can have lasting effects, even if the initial symptoms were mild, so don't dismiss your health concerns lightly. It's essential to monitor any changes in your respiratory health after a cold. If you develop new symptoms or if your cold lingers longer than usual, seek medical advice to rule out a potential lung infection. Loss of taste or smell. One of the more unexpected signs that you may have had a lung infection is a loss of taste or smell. This symptom might come as a surprise, but many individuals with respiratory infections report experiencing this peculiar change. The reason lies in how certain viruses can affect the olfactory cells in your nasal cavity, leading to an impaired sense of smell. When your ability to smell is compromised, it can directly impact your sense of taste, as these two senses are closely interconnected. Congestion and drainage often block the sense from reaching the olfactory receptors, resulting in a diminished tasting experience. While most people regain their senses after recovery, some may face prolonged effects, making it vital to be mindful of this symptom. If you've noticed a sudden change in your taste or smell, it could be worthwhile to consult with a healthcare professional. They can help assess whether this is linked to a past lung infection or another underlying health issue. Other considerations. It's also essential to consider additional signs that could indicate a lung infection. Night sweats, unintentional weight loss, and chest pain are symptoms that can signify a more serious condition. Night sweats can be particularly troubling, as they often disrupt sleep and lead to further fatigue. Unexplained weight loss can also be a red flag. When your body is battling an infection, it may not be able to absorb nutrients properly, leading to weight loss and a lack of energy. Additionally, chest pain, particularly when breathing deeply or coughing, could indicate inflammation or other complications related to lung infections. If you experience any of these symptoms, don't hesitate to reach out to a healthcare provider. They can help you navigate your symptoms and provide the necessary tests to get to the bottom of your health concerns. Emotional impact of lung infections. It's also important to acknowledge the emotional toll that lung infections can take on your overall well-being. The physical symptoms, such as fatigue and shortness of breath, can lead to increased anxiety and stress. Many people may feel isolated or frustrated due to their limitations, which can compound feelings of helplessness. Recognizing this emotional aspect is crucial for a holistic approach to recovery. Engaging in mindfulness practices, such as meditation or yoga, can help manage stress and improve mental health during recovery. Support from friends and family can also be invaluable. Sharing your experiences can provide comfort and help you feel less alone. Prevention and management. To reduce the risk of lung infections, it's essential to practice good hygiene. Regular hand washing, especially during cold and flu season, can significantly lower your chances of getting infected. Additionally, staying up to date with vaccinations, such as the flu vaccine and pneumococcal vaccine, can provide further protection against respiratory infections. If you are a smoker, consider seeking help to quit. Smoking damages the lungs and weakens the immune system, making you more susceptible to infections. A healthcare professional can guide you in finding effective resources to help with quitting. In cases where you do develop a lung infection, early intervention is key. If you suspect you might have an infection, don't hesitate to consult your doctor. Timely treatment can help prevent complications and lead to a quicker recovery. Conclusion. In conclusion, if you've noticed any of these signs, persistent cough, fever, weakness, shortness of breath, lingering effects from a cold, loss of taste or smell, or even emotional distress, it may be time to consult a healthcare professional. These symptoms can be indicators of a lung infection that requires attention. Thank you for tuning in. If you found this video helpful, please give it a thumbs up and subscribe for more informative content. Your health is paramount, and we hope this information empowers you to take better care of your respiratory system. Have you experienced any of these symptoms? Share your thoughts in the comments below. Thank you for watching, and as always, breathe easy, my friends.